My name is Dr. Ken Davis. I'm the founder and developer of the DAVIS Advanced Health System, which is an integrated program that offers educational curriculum-based programs to assist you in helping to achieve optimal well-being, not just physically, but mental, emotionally, and spiritually as well. I'm in practice since 1977. I started in Ridgewood, New Jersey, where I was there for 37 years, and I'm now in Montclair, New Jersey. I'm also a certified instructor and practitioner of many, many advanced chiropractic techniques that include craniopathy. I'm a certified instructor, what's called applied kinesiology, sacral-occipital technique, and a world-renowned authority on what's called temporal sphenoidal diagnosis and visceral manipulation. I also was a foremost teacher and researcher of vibrational therapy. Not the therapy or vibrational component that we've seen over the years, which is just laying on of hands or Reiki or something like that. What makes me different from everyone else is the ability to assess a person in their ability to achieve the results that they're trying to get that no one else has been able to, first of all, find, determine where the problem is, and then offer a remedy. One of the areas of my training, going back, way back, is a model that I still incorporate and educate and teach people in their ability to understand the underlying cause of the problem that they're having, and also the inability of many who have sought many other alternative forms of therapy and treatment that have not improved. Each of us is a triune model of health. So in the bottom angle, we're the body. We have a physical structure, a body, bones, nerves, organs, glands, tissues, and so forth. We also have another side of the triangle, which is the mental, mind, emotional side. That part is what allows us to think, reason, have emotion, feelings, desires, and so forth. But there's another side too, that is many times not evaluated and overlooked. And also, this side of the triangle, which we call the spiritual side, is the fact that recognition and understanding that we have an energy in us. We're a being. Who we really are is this spiritual being having this physical experience on earth, not a physical being trying to have a spiritual experience. And what I've learned in practice on thousands of people in the assessment is that the physical side, and I learned this many decades ago, accounts for only 1% of the origin of the underlying condition that we have or we're experiencing, no matter what it is, the most serious illness to an acute back problem. 1% is the body angle as a cause, 9% comes from the mind side of the triangle, and believe it or not, 90% of human beings' ills and breakdown come from the spiritual side. That's right, 90%. People ask me, what do you mean by that, Dr. D? If we're spiritual beings having the spiritual, physical experience on earth, the essence of who we are only knows joy, love, abundance, growth, and so forth. But the light that is us can be blocked through lampshades that develop through our life by trauma, stresses, hurts, woundedness, and so forth. Also, in understanding a triune of well-being or a triangle, remember that if one angle of a triangle becomes imbalanced, they're all going to be affected. So that means that if we have a leak in our ceiling and it's affecting the tile on our bathroom floor, the tile is going to still get damaged until we fix the leak. So in this triune model that we offer in our system of care, we can assess really where the triune or the imbalance is coming from. So that's why you can have, let's say, 1,000 people that have a chronic condition, and 300 of it come from the physical side of the triangle, 400 come from the mind side, and the rest come from the spiritual side. How do we know? Unless a system has been developed. And that's what we've done, and I've done over the last almost 50 years. To be able to assess that Triune of Wellbeing to determine the underlying cause of the problem and offer procedures, very advanced procedures that can address the primary component of that triangle and correct it, utilizing these procedures and techniques that I've mentioned. Also, in offering in our practice, in our clinic, educational curriculum programs, as I mentioned, what we do is we look at, because we also want to be proficient and have the techniques necessary to be able to not only correct the underlying problem, but also what's being affected in our structure, in our organs, in our hormonal functions, whether or not we need cleansing, detox, also the way to really understand how we should be eating. Because I've been there, I've seen it all. From Eat Right, Fit for Life, every particular diet, whatever, over 50 years. I've seen it all, what works, what doesn't work, and also everything that I've recommended to patients, I've always done myself. And there's a lot of things that come out over the decades and years that, okay, work. See, the problem is that a lot of the things that are offered and out there that I see over the years, are anecdotal. Meaning they work on 3 people, but they don't work on 20 after that. If a procedure, or a technique, or a system is going to be utilized, it should work primarily out of 9 out of 10 people. Going back in time, there were no health food stores when I started practice. There was like one. Now, it was like with bins where fruit flies were flying out of them and so forth. So much has changed over the years. And I look and I see on social media and whatever, all the different techniques and things that people are doing and whatever. And a lot of times there's no background or understanding or depth of practice. Someone takes a course over the weekend and then calls himself a master. It's not where it's at. Or offers a patient or someone out there an adjustment and an x-ray for $19. That's not where it's at. And I'm not afraid to let people know, because I am an instructor and I've taught hundreds and hundreds and hundreds of doctors, physicians, massage therapists, acupuncture. But getting back to our practice and what we offer is, as I mentioned, we offer mentorship. We offer in my team to be able to teach you what I've learned and what we've learned over 50 years about well-being, growth, spirituality, of how it impacts our health, exercise. I'm also a 72-year-old. I'm an IFBB pro professional bodybuilder, having reached pro level at age 70. I've written numerous books. I just published my second one called Holistic Bodybuilding, The Aging Antidote. So we utilize other components to teach you about detox, hormone health, metabolic typing, to know exactly through blood work how you should be eating. Not everybody is meant to eat the same thing. And that's also, you have to be keto, you have to be this. How do you know? We have systems. If you would like, and you're having a health crisis or an issue, or don't know what's going on or need help, we believe that the DAVIS Advanced Health System is the last health system you'll need. Because we are, in a sense, the one shop for everything. And we have outreaches with other professionals that are linked to us that, when needed, I can utilize and have relationships with other healthcare practitioners that understand the type of work that we do. And when needed, we bring them into the picture as well. We offer our service to you and are there for you 150%. We're always available to you once you become a practice member of our practice. Yes, we are a fee-for-service practice. We are not insurance dependent. I've never been that way for varying reasons, but we do offer the ability for diagnosis codes to give you for reimbursement procedures. And certainly we can discuss what it is that we feel in our programs are best suited once you have an evaluation with us. If you'd like more information or you'd like to make an appointment, please, first of all, check out our website, www.davisahs.com, or call our office at 973-744-7447. To know even a little bit more about me, I've been featured on the cover of Top Doctor magazine. You can look at that on the web. Top Doctor, the July edition. You'll see me. Also, I mentioned my book. Again, check us out. I'm here for you. We've had people who have not responded and been helped that have come to us where they couldn't be helped anywhere else, and have had many procedures. I've traveled all over the world. I've studied the ancient religions, all the healing practices of the cultures, and have incorporated that as well into all that I do. So thanks for your time. Give us a call. We're there for you. And again, thank you. I'm Dr. Ken Davis of the Davis Advanced Health System. Thanks so much.